We all know that exercise is beneficial for a healthy body, a healthy mind, and also a healthy heart. I'm sure I don't have to convince you when it comes to talking about benefits of exercise for a healthy heart.
Yes, exercise is just as important as diet in not only maintaining ideal body health, ideal body weight, and also for the health of your heart. So most of experts, most of the guidelines say that at least 30 minutes of exercise, good quality aerobic exercise for at least 5 times a week is the minimum that is required for good heart health. So that comes to an average of 150 minutes of good aerobic exercise, moderate intensity exercise, that is minimum that is required for a healthy heart and a healthy body. However, there are several aspects to exercise. One is aerobic exercise, which is good from the point of view of heart fitness and overall general health. Second is muscle health. So for muscle health, we need a little bit of weight training, which is required by using low intensity, low amplitude weights with frequent repetitions, which is very good for maintaining the health of the muscles. And the third aspect of physical exercise is flexibility. For flexibility, we recommend exercises such as yoga or stretching, which is very important to prevent injuries when you do the other forms of exercise. So if you have a flexible body, you are less likely to be injured when you do a jog on a treadmill, or when you do a run, or when you do any other form of aerobic activity. You are less likely to be injured if you are flexible.
But doctor, is there such a thing as too much exercise? Because these days we see especially young persons collapsing at the gym while working out. Why do you think this is happening?
So we know that minimum amount of exercise is about 150 minutes of moderate intensity exercise that is good for the heart. So what happens if you exercise more than that? So as you keep on increasing the amount or the duration with which you exercise, the benefits keep on increasing, and you can go up to a maximum of 600 or 720 minutes of exercise per week. When we speak of exercise, what is good for health and what is good for the body overall is a moderate intensity exercise, which is in the aerobic range. So there is a certain range of exercise during which allows optimal functioning of the body systems, including the heart. So it is recommended that 80% of exercise should be of this intensity, is of moderate intensity, and only 20% of exercise should be of high intensity. So what is high intensity exercise? So high intensity exercise is exercise of an extremely high level where your heart rate goes up very high. So it is ideal that a person exercises within the heart rate of 60 to 80% of his maximal heart rate. That is where you get the maximum benefit in terms of cardiovascular health. But there are some disadvantages when people try to exercise too much. Like, for example, you must have heard of several incidents in recent times where otherwise young people, otherwise healthy people collapsing after a session in the gym, after a session of intense exercise or intense physical exercise in the gym. You must have heard of incidents where some people have done a marathon and they have collapsed immediately after a marathon. You must have heard of some people who have been training very well, and after one such training episode they have suddenly collapsed. So these are rare events. These are not the rule, but these are the exceptions. But however, there is a lesson to be learned from these incidents. Why do these incidents happen at all? One is, it is possible that an individual has got a pre-existing silent heart disease. But suddenly when you go beyond a certain limit, so then the heart gives up. So that's when these kind of untoward incidents happen. Also, it's very important is that when somebody is overtraining, is doing too much exercise without allowing time for the body to recover or for the heart to recover, this might actually cause a spiraling vicious cycle of damage to the heart and may result in a cardiac arrest. So therefore, any individual who is more than 40 years of age if he's starting an exercise program fresh, or if he's embarking upon an exercise program that is highly intense and highly beyond the normal physiological limits of a heart, so then it is probably prudent to have a pre-participation physical examination and a health evaluation by a physician to rule out underlying heart disease, which can precipitate sudden cardiac arrest in these individuals.
So doctor, how about people who don't exercise at all? I mean, is it too late to start exercising? What is your recommendation to someone who wants to start exercising?
Yes, if someone wants to start exercise, no age is too late for them. Only it's important that if somebody is old, that's older than 40 years, and wants to start an exercise program, it is prudent for them to undergo a health evaluation by a healthcare professional to do a baseline evaluation of their health, and thereby they can get a recommendation on what is a safe level of exercise to start with. So we do a process called cardiac rehabilitation. In this, we make a baseline assessment of the health condition of the individual. We make a baseline assessment of the physical exercise capacity of the individual, and based on that, we start slow and ramp up in time and intensity over a course of few weeks or months. So it is very important that one should exercise, but you should know how to start an exercise program, and you should know what are the precautions to be taken when you start an exercise program, and we should be aware of the fact that we should not do overtraining, we should not over-exercise, and we should keep most of our exercise within the healthy range, that is within the 60% to 80% range, and only small percentage, and that too only in individuals who are training for a specific event or a specific event like a marathon or a specific sporting event, only they are recommended to go for a high intensity exercise training.